Hi, this is Diane, and welcome to DMD Digest. Today I want to talk to you a little bit more about functional medicine and the role that it plays in our GI health. As I've mentioned before, I've talked a little bit about functional medicine in the past and the specialty in this kind of that area, and wanted to shed a little bit more information on that and explain a little bit more about what a functional medicine provider does, what their education is, and kind of their approach to treating GI disorders. If you've listened to any of the other videos that I've done in the past, you'll know that I've talked a lot about different disease entities and symptoms and different ways to try to manage it, different tests as well as foods to consider, avoid, try, protein powders, different types of diets, Keto and Paleo and Fodmap and celiac and gluten and lactose intolerant, all types of different things. So today, focusing more on functional medicine specialists. Generally, their background is chiropractic, but it doesn't have to be. It could be primary care medicine, it could be advanced practice, primary care, internist, anything of that nature. The functional medicine component is actually additional training that the individual is doing in ways to manage our health conditions and symptoms by using diet, often exercise, the mental component, like looking at relaxation, imagery, mindfulness, different things like that. So it's not necessarily the specific American or Western way of dealing with things, which would be as a prescription. So functional medicine is going to focus more on, for one, diet. And like I said, I've mentioned a lot of different diets. It's not necessarily a diet per se, but it's looking at foods that you're eating, things that you're drinking. As I've mentioned before, looking at probiotic foods, fermented foods, kombucha, any of those type of highly bacterial laden, if you will, foods, and looking at bacterias that are in general, from lactobacilluses to bifidophilises to spore type organisms. They also look at vitamins, minerals, supplementation, looking at bone broth, which I've mentioned in some previous videos, collagen, all types of different things. Another avenue is looking at testing. So if you're going to a functional medicine practitioner, they're likely not going to be doing what would be a typical blood test or workup that you might find with internal medicine. Internal medicine is going to focus more on complete blood counts and your glucose or sugar levels, your lipids, which would be triglycerides, cholesterols, HDLs, LDLs, looking at your thyroid, looking at those types of things. And those are critically important, don't get me wrong. Functional medicine is looking at things a little bit differently, generally focused on your immune system, things that can throw your immune system off, looking at blood work that's going to specify those type of abnormalities. Another thing that can be done is something called GI mapping. And this is a little bit different, not something that internal medicine does as frequently, or even GI specialists. So GI mapping is actually where you are looking at a stool specimen and sending it out for a microbial assay test. So it is going to look at the different things that are in that stool, and might be a little gross to talk about, but you know, we all do it. It's a byproduct. It just happens, if you will. So in the stool sample, we're looking at possible sources of our distress, looking at infection, looking at are there parasites, bacterial, viruses, fungus. There could be a multitude of different things that is growing in your GI tract, hence creating the gas, indigestion, heartburn, bloating, severe diarrhea, severe constipation, food intolerances and sensitivities, all of those symptoms that I talk about. So that is actually a really good, sound way to kind of find out what's going on in your gut, what's happening. Other things you can do are breath tests, we've talked about, which measures the breakdown of some of those bacterias in the form of gases. You can do sugar type related tests that are looking at lactose and mannitose and other types of sugars that can be a byproduct of bacterias breaking down in your GI tract. Another thing that is sometimes looked at is a test called a Zonulin test. And Zonulin is actually a protein that ends up as a byproduct, once again, from things that are digested and the bacteria that grab onto those. And yes, we have good bacteria in our GI system as well as not so good. And it measures that level. And we know that sometimes different bacteria, different foods, different things that happen in our intestine create that leaky, too permeable membrane, which is also known as leaky gut syndrome. And that is just meaning that because of a multitude of things possible, stress, diet, what we're eating, drinking, some different conditions, especially autoimmune conditions, diabetes, thyroid disorders, things like that, can ultimately create abnormalities in the way our intestines absorb different food, minerals, that type of thing, and therefore can kind of set off this chain reaction of events that happen. So in a nutshell, very, very simply, that is kind of leaky gut syndrome. Those are just a few of the different tests that can be done. There are a lot of other things that can be done, and I am certainly not the expert in functional medicine or to be able to give you a more detailed description of all the different things that can be done. And it isn't just necessarily functional medicine. A lot of gastroenterologists have incorporated some of these different tests and this belief system in their care and how they manage their patients' symptoms. So I would strongly encourage you just to consider this other approach to managing your symptoms in addition to or other than taking medication or taking products over the counter. We know along that line that because of all these symptoms that we've talked about and the pain and just the problems associated with everything, it kind of starts significantly altering our eating habits. And I've touched on a little bit of this in the past. I'm going to try to talk a lot more about those eating habits and how those change to the point where an individual with chronic GI problems is not going to eat the same as someone who doesn't. And generally that's pretty noticeable to people, and it can be really awkward and uncomfortable. And you can kind of see extremes. You can see people who are trying to manage their symptoms by being extremely selective of what they eat and drink. Sometimes that can get a little too much or overly restrictive to the point where the individual is, I know in a circumstance that I can personally relate to, there are certain things that just frighten me to consider eating or drinking, because I know what is going to happen, and so I try to avoid it. Sometimes I can do that, and that's not a difficult thing. Other times it's really difficult, or it creates a really uncomfortable feeling emotionally, and certainly, at an event, because my eating habits are going to be significantly different than everyone else. The same is true for anyone who has any type of food allergy or sensitivity. You just don't feel normal. You don't feel like everyone else. You don't eat what everybody else is eating. You often will not even attend different functions and different things that other people are going to be attending, places that you really, really want to go, but there's going to be food there that you're maybe going to be tempted to eat, accidentally do eat, or eat it or drink it on purpose just because you're sick and tired of feeling sick and tired all the time and feeling like you don't fit in. So this can actually end up creating, in its own way, your own type of disordered eating. And individuals that I've talked to that have come to me also, will sit and tell me, sometimes in tears and so frustrated because they look like they have a very diagnosable eating disorder. And in actuality, they kind of do. Eating disorders are not just anorexia, which I think most everyone is familiar with, that, the person is afraid to eat because they're afraid of gaining weight. And so therefore will restrict their diet profoundly to the point where they actually do become emaciated. There is so much more in depth, so much more information into what it takes to actually diagnose that, which we're not going to get into because this is not specifically about anorexia nervosa. But there can also be other types of disordered eating habits where the person is so preoccupied with trying to eat clean, or meaning trying to eat healthy, not eating contaminated food or GMO laden food or sugar or artificial sweetener or you name it, any chemical out there. That also is a disordered type of eating. Not necessarily that I'm saying that everything is all bad and, oh my goodness, let's put a diagnostic label on you. Not at all. But just to point out that because of these gut disorders that we have, our eating has become disordered or not very normal. And that in turn creates a whole nother set of problems, which will exacerbate your GI symptoms that we're trying to avoid in the first place. And because this can be so in-depth and so much information, I'm actually going to switch gears a little bit more in these videos and focus more on some of those different eating disorders and what we do, how to manage them, how it feels, how you're struggling with it, where to turn. I totally understand. I feel your pain, literally, and hope that by listening to this, I can give you some optimism and some hope to hold on to and continue to encourage you. So, with that being said, thank you so much for your time and your attention to this. And I look forward to being able to share more information with you the next time we meet. Thank you so much for listening.